Hello, I am Darcy Lafleur, and I will be presenting information regarding the need for a community paramedic program for seniors in the state of Colorado. By the year 2030, it is predicted that 20% of the U.S. population will be 65 years of age or older. This is double the current number of older adults in the United States today. Additionally, according to the U.S. Census Bureau statistics in 2010, the population of people 85 and older will increase from 5.9 million in 2012 to 14.1 million by the year 2040. It is expected that the state of Colorado will see a 150% increase in seniors between 2010 and 2030. This population is at risk for many reasons, from suffering from multiple chronic health conditions, higher risk for falls, mental health conditions. They are at higher risk for infection from communicable diseases, elder abuse, and often their mortality rates are higher for both medical conditions and traumatic injuries. Social determinants of health that particularly affect the older adult include economic resources, access to community-based resources, their living environment, and transportation options. Furthermore, seniors in rural communities and those that live in poverty are more vulnerable to chronic conditions and worsening health. This particular diagram shows the percentage of persons over the age of 65 by state according to the 2012 Census Bureau, and as you can see, in the state of Colorado, we are at 11.8 to 10.9% for the year 2012. Seniors are the fastest growing age group in the state of Colorado. According to data collected by the U.S. Census Bureau, in 2012, there were 613,241 people over the age of 65 in Colorado, and between the years of 2002 and 2012, the population of seniors increased by 41.7%. While seniors in Colorado are generally more active and healthy compared to the rest of the country, they remain less healthy than the majority of the population. According to the National Institute of Health in 2010, Florida, Maryland, West Virginia, and Pennsylvania were all states with the highest proportion of seniors over the age of 65. Additionally, the western and southern parts of the United States are the areas experiencing the fastest growth of people over 65 years of age. The senior population in Colorado is growing rapidly, and the demand for healthcare services is outpacing the supply. It is imperative to collaborate with interdisciplinary teams to ensure that seniors can access the care they need when and where they need it. Using the ecological model for assessment, we take into consideration all factors that may influence a senior's health. For instance, the person's health behaviors, their home and geographical environment, age, cognitive level, socioeconomic status, and chronic health conditions. By using the ecological model, we can assist healthcare providers to identify how individual choices and behaviors affect health, as well as how we can best use community resources to improve senior health. Health literacy is certainly affected by a patient's age. People over 65 have been shown to have lower than average literacy scores related to the rest of the population. As we age, our cognitive ability, vision, and hearing all change, leading to issues with literacy. It is imperative for providers to be able to provide information in various forms such as print, verbal, video, and demonstration. Within the senior population, it is recommended that there is follow-up within a few days to review essential information and ensure comprehension. Community resources available to seniors vary based on geographical location. Some examples of resources may include local senior centers, Meals on Wheels, physicians and dentists certified in gerontology, chronic disease support groups, senior-specific recreation centers or recreation centers with special times and classes for seniors, and creative aging programs. Statistically, Colorado ranks number 1 for health status of our seniors. However, they still have multiple chronic conditions and healthcare needs. According to the information on this slide, 80% of seniors in the United States have at least one chronic health condition, and seniors in Colorado are more likely to suffer from a chronic condition than the rest of the population in the state. Seniors in Colorado are at risk for high morbidity and mortality related to cardiovascular disease and stroke, as evidenced by data showing that cardiovascular disease and stroke as a leading cause of death in Colorado in the year 2013. Deaths related to these two conditions account for 24% of all the deaths in the state. According to the Colorado Department of Health, approximately 1 person dies from cardiovascular disease every hour in Colorado. This slide also shows that the prevalence for high blood pressure and other risk factors for cardiovascular disease are also on the rise. Seniors in Colorado are at risk for unintentional injury, such as falls, as evidenced by surveillance data by the Colorado Department of Public Health and Environment, showing that Coloradans over the age of 75 are more likely to be hospitalized or die from an injury. Additionally, 70% of emergency room visits for this age group are due to fall-related injuries. These rates are equally as high for seniors 65 to 74 years of age and those 85 and older. The tables in this slide show both death rates and hospitalization rates by age for Coloradans from 2009 to 2013. Seniors in Colorado are at risk for readmission to the hospital within 30 days or inappropriate use of the emergency department, as evidenced by a readmission rate in 2013 of 14.8%, and data specifying a lack of providers available to meet the needs of the patient in a timely manner, leading to an increase in emergency department visits at a rate of 44.1%, according to a Colorado Health Access survey in 2012. Colorado ranks 9th in the United States for readmissions of seniors, and the high readmission rate is often due to the fact that patients have a lack of resources for obtaining and managing medication, transportation to follow appointments, or access to a primary care provider. Based on the community diagnosis, seniors have several needs such as frequent follow-up care, medication management, chronic disease management, along with personalized education for both. They are in need of home safety assessments to identify risk factors for injury and need to be educated in injury prevention and the importance of physical activity, including strength and balance exercises to prevent falls. Additionally, being able to be triaged to the appropriate care provider rather than returning to the hospital emergency department for readmission, and finally, preventative care within their homes. These diagnoses and needs align with the Healthy People 2020. The older adult objectives are new to Healthy People 2020, as it was identified that adults over 65 are the fastest growing population in the United States. The community paramedic program would help to meet some of the Healthy People 2020 objectives. First, by ensuring seniors, both male and female, are up to date on preventative services. Next, the community paramedic can help seniors learn to manage their chronic health conditions and medications within their own home. The community paramedic can also work with seniors to tap into resources and improve and engage in light, moderate to vigorous leisure time activities. Finally, the community paramedic program can assist in triage of seniors to ensure that when they are ill or injured, that they are referred to the appropriate level of care. A community paramedic program has the potential to increase care for seniors in their homes and local community, decrease readmissions, and improve vaccination rates. Community paramedics are trained to complete home safety assessments, identify resources needs such as food, assist in managing chronic diseases, post-hospital discharge follow-up, complete assessments with referrals to care, vaccinations, and many other necessary healthcare needs. Using the community paramedic program could decrease in-hospital readmission rates as patients are being monitored regularly. Additionally, patients who may need to be admitted could be triaged by the community paramedic and referred to the appropriate care provider rather than always to the emergency department. There is limited research in the field of community paramedicine. However, the little research that is currently available shows that the community paramedic fills a gap in the healthcare, especially in rural areas or where seniors have limited primary care services. This non-traditional model of care outside the usual 911 emergency model has the potential to decrease the number of non-emergency calls and create cost savings for patients, EMS providers, and the entire healthcare system. Many programs across the United States are currently in pilot stages. Therefore, data is still being collected. It is predicted that when all the data is collected, they will be able to show the value of a community paramedic program, including cost savings and improved patient outcomes. The final challenge to all of the programs is funding and reimbursement of community paramedic services. Many programs are working with local legislature to change laws regarding destination for ambulances and fee-for-service payments. As members of the healthcare community, it is our responsibility to do no harm. Many times we find that seniors living in their own homes and we feel it is not the ideal environment. Ethically, we need to consider what is the patient wants if they can manage their own care and if they are safe. The community paramedic program is there to assist patients to remain independent and age in place rather than to be moved to long-term care. Sliwa et al. Defined community readiness as the observable and psychological characteristics of a community that influence the ability to initiate change. It is imperative that the community is open to the concepts of the community paramedic program and that there is time to pre-plan and prepare in order to successfully initiate and sustain the services into the community. The success of this program is determined by community partnerships, an accurate community needs assessment, improved access to care for referrals, and use of evidence-based practice using interdisciplinary teams. We will seek support for the community paramedic program from the local acute care hospital, physicians, fire and emergency services, and the public health department and local government. In this logic model, we identified the resources needed to implement a community paramedic program, their expected activities, our participants and providers, as well as final outcomes. Through implementation of the program, we would like to see our senior population manage their care at home, a reduction in readmissions and ED visits, and ultimately having our seniors age safely in place. If all of these components work together, there will be an overall reduction in healthcare costs. Dixon et al. Researched the cost effectiveness of a paramedic practitioner program, which is equivalent to a community paramedic model in the United Kingdom. They used a cost-utility analysis looking at the health benefits in the form of quality-adjusted life years and associated incremental costs such as program cost, other emergency responder fees, emergency department costs, inpatient costs, and primary or community care costs. Their conclusion was that there was a statistically significant change in the use of healthcare resources, reduced use of the emergency ambulance, reduced number of ED visits, and inpatient resources. It is estimated that about 20% of 911 calls are non-life threatening. The cost of each transport is approximately $1,000 and the average ED visit is $2,000. By using the community paramedic program, patients could save hundreds of dollars by avoiding an emergency room visit. The community paramedic program will seek grant funding from the Colorado Department of Public Health to ensure funds for the first 2 years of operations. During that time, the community paramedic program will work with the state and federal legislature to provide waivers from Medicaid and Medicare to fund the program in the future. The population of the United States is rapidly aging. In fact, the fastest growth is being seen in seniors 85 and older. With that being said, healthcare costs for seniors is also increasing and the availability of healthcare providers is scarce, especially in rural communities. Seniors tend to suffer from chronic disease, sustained injury, and are primary users of the emergency department. These three things are the primary drivers for healthcare costs for seniors. By implementing a community paramedic program, we can reduce gaps in care and provide resources for our senior population in order to improve their overall health and keep them living independently longer. The community paramedic program promotes healthy aging through individual education, medication management, acute care follow-up, injury prevention, and providing preventative services such as home safety checks, health screenings, and immunizations. By establishing a community paramedic program, all of the services provided come at a cost savings to the senior, the local EMS agency, and the entire healthcare community. I appreciate your time and hope you will consider supporting the community paramedic program. Thank you.